All right, folks, joining us, as he does every Friday, is our friend, Dr. David Samadi, chairman of Urology and chief of robotic surgery at Lenox Hill Hospital. It is good to see you, doctor.
Thank you, and thank you for inviting me.
Well, so it's our pleasure. All right, so Tuesday was World Cancer Day, and I think today a lot of people are wearing red to make for women to make be aware of it's something to do with women's and cancer. But Tuesday was World Cancer Day, and of course, you know, your forte is deals with prostate cancer, and but you know, we've been led to believe by the reports that have come out, recommendations, and I think it's all connected to trying to save money. You know, women shouldn't get mammograms until they're 50, and then they should do it every other year. Men, they don't need a PSA, the blood test, because everybody's going to get prostate cancer one way or another anyway. I mean, this is not something that you agree with, certainly.
Yeah, absolutely. And here's what's going on. When we talk about women and mammogram, and when the country and government comes and says, don't get mammograms, all the women are out there protesting against it. And there was a recent article that came out and said, if you get mammogram every year, based on the way American Cancer Society is recommending, it would cost about $10 billion. But if you go every other year, as the new recommendations are, we would be saving $7 billion. The big question is, Steve, what is the price and for one life? What's the cost of that? What's the cost of when the cancer spreads and you have to give all this chemotherapy, other treatments? So prostate cancer and breast cancer go parallel, hand in hand. 230,000 men are diagnosed with prostate cancer, almost the same amount with breast cancer. 30,000 men die from prostate cancer, same number almost with breast cancer, but men were sleeping behind the wheel. When they say no PSA, all the guys are going in and they're just not going to get tested. It's a good time to understand that prostate cancer, it's not the old man disease anymore. We're seeing a lot of 40-year-olds, 45-year-olds in our practice with deadly cancer, and you have to get tested. So knowing your PSA, Steve, is extremely important, and that's what we want the public to know.
Right, and it's important to compare the PSA to the previous PSA, especially to make sure it's not progressing too high. Now, talk about the robotic prostatectomy. Is that how it's pronounced?
Absolutely. The easier way of saying it is robotic prostate surgery. And
that I could have said.
Basically what it is, it's removal of the entire prostate using minimal invasive or this remote control surgery. So why are we not using the traditional open surgery is because when I was opening the patient up using my hands and tactile feedback and touch, we were causing a lot of bleeding. You couldn't see the anatomy, and as a result, the incontinence or urinary control or sexual function, which is a big part of the quality of life, wasn't so good. Now we took all of that experience and now we're using it with this fancy robot. What it means is that you have a camera, you can see those sensitive nerves, you can make sure that the patient is cured of cancer without having any complications. There's no transfusion, pain is under control, and if you look at what we've developed at Lenox Hill Prostate Center, patients are coming in on the day of surgery, and I perform the entire surgery. This is unlike many other institutions we have in New York where the surgeon goes from room to room, and it's the factory mentality, which never made any sense to me. So I perform your entire case from the beginning to the end. Surgery is about an hour. There's no blood loss. And they go to this beautiful private floor, Steve, which has changed the whole recovery. They're in this beautiful four-season floor, which is part of the recovery, and they go home the next day. So 95% cure rate as a result of this, 97% chance of urinary control, 85% chance of sexual function, and it has revolutionized the way we practice. Now, the criticism of robotic surgery, Steve, is that there are a lot of technicians out there that are not good surgeons. So when you choose robotic surgery, you're choosing the person and the experience behind these robots.
Sure, the person who's going to run the show. We're talking to Dr. David Samadi here on the Steve Malzberg Show. Of course, the doctor is chairman of urology and chief of robotic surgery at Lenox Hill Hospital here in New York City. Prostate cancer, unlike breast cancer, where you could you could see lumps or feel lumps, you could check yourself every day. Prostate cancer, I mean, basically there are very few symptoms, if any, sometimes. Correct?
That's an excellent question that you bring up, and that's part of the reason why I'm always part of your show every Friday, and people love it. These are great questions. Prostate cancer is also known as a silent killer. So the PSA, the blood test that we use, which is not specific for prostate cancer, enlarged prostate can increase it. Inflammation of the prostate can do it. So knowing your PSA is important, but also that exam, the prostate exam, is a big part of this.
That's called a digital exam,
digital
right? Where the
exam.
doctor feels the prostate.
And
yeah.
That's right. And unlike breast, where it's right out there and you can examine it, prostate happens to be in a deeply positioned organ way under the pubic bone or bony structure over
You're
the rectum.
making me cringe because now I'm thinking of when the doctor does it. It's like I'm getting shivers up my spine.
Anyway, it's once a year that you need to do this. You need to know what your PSA is. And I want people to know that if you choose the right surgeon and the right technique, this is a curable disease. Now, you would ask, why do I recommend surgery before radiation? Guess what? If you do surgery, you will get a lot of important information. How much cancer you have. Where is your cancer? Has it invaded the surrounding tissues, which you would not get with radiation? If your cancer comes back after surgery, then you can choose radiation as plan B. If we do radiation today, Steve, you can't have surgery after radiation. So you want to keep your options open and use radiation as a backup plan after surgery.
And surgery, by implication, is the removal. That's the express purpose, is the removal of the prostate.
Just like any other organ, surgery is always the first line of treatment. And the reason why even radiation got into our field was because open surgery was difficult and challenging and caused morbidity. Now with this advance, and now we've done close to 6,000 robotic surgery out there, so we're making a big difference, and I don't want people to be scared. Just choose wisely.
All right, how difficult, we only have a couple minutes left, Doc, how difficult is it going to be to overcome these new guidelines where they're urging men not to get tested and even women to have the mammogram later in life and then less frequently when it's hard enough to get them to do it in the first place?
Absolutely. I think these guidelines are really for the entire country. But when it comes to your own health, you have to be your best doctor and you have to stay on top of things. If you're going to follow everything that the government is telling you to do, you won't be doing any of these tests and you're going to find out that the cancer is already spread. So I want to thank you for bringing this to the surface, for educating a lot of people, and being a venue to make awareness about this. And given this week, which is about the World Cancer Awareness, you're making a huge difference. And I thank you for giving this message to a lot of men. And you know who is really bringing men to my office? It's the wives and the girlfriends and the partners that really make them to come and get tested. Right.
Well, it's a smart thing to do, and you know, I get it done every year, and it's just a smart thing to do. Dr. David Samadi, and you watch him on the Fox News channel on House Calls, 10:30 a.m. Eastern Time on the Fox News channel. My friend Eric Sean, say hello to Eric. He and I go way back. And Doc, we'll speak to you next week. Thank you very much.
Thank you very much.
All right, folks. So when we come back, Dan Gaynor is going to join us from the Media Research Center. All these stories, all the coverage of the anti-gay bias in Russia, especially surrounding the Olympics, how much coverage do you think that's gotten compared to the killing of Christians, the burning of churches, the persecution of Christians around the world, especially in the Middle East and parts of Africa? You may not be surprised, or you may be amazed. We'll talk about that when we come back. We'll also have our panel. All that straight ahead on the Steve Malzberg Show, Newsmax TV and radio.